Good morning, everyone. Thank you for being here for today's webinar on the 2026 rate information. This webinar is proudly presented by CSSHSA, collaboration with WorkSafeBC. And in this webinar, our speakers will provide an overview of the current state of the workers' compensation system, any changes to rates and classifications, and time loss statistics for organizations in the social services sector. Before I introduce our speakers, I just want to take this time to acknowledge that CSSHSA provides services to, lives, and works on the traditional, ancestral, and unceded territories of more than 200 distinct First Nations in British Columbia. In our work and in our lives, we are committed to listening and learning, to walking the paths of truth and reconciliation, and to working in partnership with Indigenous organizations, leaders, and communities to ensure workplace health and safety is safe, inclusive, and culturally relevant. With respect, I'd like to take this time to express my gratitude to the Indigenous, Métis, and Inuit people and their ancestors who have lived on and cared for these lands for generations so that we can all be here today. I'm calling in from the land of the stolen ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh people in Vancouver. I welcome you all to acknowledge the land you're coming from in the chat box. And thanks, Tom, for doing that already. To ensure a smooth and engaging session, here are a few tips for using our chat and Q&A features. Jackie, one of our OHS advisors, will be moderating the chat and will address any common questions that fall outside the speaker's scope. We do encourage you to interact and respond to each other's questions when relevant. And if you have any questions specific to the speaker and their presentation, please use the Q&A box so that they can address any questions after the presentation. Before I introduce our speakers, Jackie, feel free to introduce yourself. He's one of our OHS advisors.
Hello, everyone. Yeah, I'm Jackie, one of the occupational health and safety advisors with the CSSHSA. And like Therese said, I'm going to be moderating today. And yeah, I'm looking forward to supporting all the organizations here in the sector. So feel free to send any questions in the chat box. Thank you.
Thanks, Jackie. All right, I am thrilled to welcome two representatives from WorkSafeBC who support workplace health and safety across BC. First, we have Krista Burke, manager of the Class and Rate Modification Program. Krista plays a key role in keeping the classification structure responsive to the changing nature of the work in the province. Joining her is Corey Grischuk, industry and program specialist with prevention programs and services. Corey's work focuses on positively influencing health and safety behaviors through education, consultation, and collaboration with industry associations like us, CSSHSA. Corey's part of our advisory panel as well, labor organizations, and other partners. Please join me in welcoming Krista and Corey from WorkSafe BC. Ken, feel free to share the presentation on your end. Thank you so much. I'll see you, everyone. Enjoy the webinar.
Thank you, Therese. Very good. All right, very good. So next slide, please, Ken. All right, here's the agenda that we're working with today. I'm going to take us through the first three topics of how we set insurance rate and classify industries, and then insurance rates, specifically to Community Social Services, HSA, and experience rating. Then Corey will take us through the time loss claim statistics, WorkSafeBC resources, and some return to work. Next slide, please. All right, so how we set insurance rates and classify industries. I'm going to start off with some of our key results for 2024. When we start talking results, we're talking about 2024 results as opposed to something more current. And the simple reason is that 2024 is the last full year of results that we have that goes into and influences the 2026 rates. So keep in mind that if your claim cost performance has dramatically changed only in 2025, it's not going to impact your 2026 rates. So now looking at some of the key results, we see that the injury rate is 2.02 claims accepted per 100 person years of employment. And when we look at return to work, we see that 79.7% of workers are returning to work within 26 weeks or less. And in terms of our investments, our 2024 results of 11.6% have exceeded our required rate of 4.7%. Now looking at the 2026 preliminary average industry base rate, it is remaining flat at 1.55, and it has been the same since 2018. Please keep in mind that this is the average industry base rate for all of BC, not just these industries today. It's derived by taking an average of all of the rates of all of the classification units in our system. So does that mean that your premium rate or even your industry's base rate is going to remain the same for 2026? Not necessarily. It's talking about the average rate for the system as a whole, and as was the case in recent years, the average rate remains the same. Even though the average rate remains the same, many employers will be seeing rate decreases and others will be seeing increases. And a minority of firms will see little or no change at all. Next slide, please. This slide provides a valuable historical perspective. It provides on one slide our rates and our costs over the last 20 plus years. The story told by the yellow line for the average base rate is that it's been consistently below the blue line, which is the average cost rate, since 2007, indicating that a history of favorable investment returns has kept rates below the cost to run the system since that time. This is also how WorkSafeBC returns a surplus. You may have seen on the previous slide that $570 million is expected to be returned in 2026. With that, we expect to return a total of $3 billion between 2019 and 2026. Now looking at the overall chart, we are starting to see higher costs similar to 2021 and 2015. Prior to 2015, you'd have to go back to 2004 to find a cost rate that was higher. Despite these cost trend concerns, for now, the good news is that the 2026 average base rate will continue to remain flat at 1.55. Another message I want to discuss on this slide concerns the administration costs. As the red line at the bottom of the graph shows, the administration cost rate has remained consistently flat for the last 20 plus years, playing no role in the changes to the base rate shown above. Next slide, please. Thank you. This slide shows us how BC's economy is organized for a classification and rate setting structure. We divide BC's economy into sectors and subsectors. Most industries are then represented as a classification unit or CU. CUs are then placed into industry groups, then assigned a rate group. Now let's look at the structure a little bit more. As mentioned on the last slide, the foundation of our system is something called a classification unit or CU, and it's shown here as a golden block at the bottom of the middle image. Each CU groups together businesses that do similar work, so your peers and your competitors. Now, most industries aren't large enough on their own to have a statistically reliable rate. So we group them into one of the 233 industry groups. Some of these, like forestry, long-term care, and community health support services, are big enough to stand alone. In fact, 35 industry groups are large enough to become their own independent rate group. The rest are placed into rate group bands that match their claimed cost rate. And the scale on the right-hand side of this slide shows you the range for each of the 20 bands. So in total, we have 55 rate groups, 35 industry-specific ones, and 20 bands. And that's the structure we use to set base rates. And that would be it if nothing changed ever. However, all industries evolve over time and not at the same pace or in the same way. Some get safer and others face new risks. So every year we review where each industry group sits. And if an industry group's claim costs go up, they move to a higher rate group band, which means higher insurance rates. This helps ensure that each industry is paying a rate that reflects its actual risk. And it also encourages employers to focus on injury prevention. On the flip side, if an industry's claim costs go down, they move to a lower rate group with lower rates. This slide shows us the three components that drive or influence the premium rates, the insurance rates. Claim costs is a significant driver, and the number of claims influence those claim costs. And then we have investment returns. Investment returns are out of the employer's control, but what the employers do have control over is the number of claims and claimed costs. These can be impacted through prevention and return to work efforts. Now we're going to talk about the insurance rates specific to the classification units of these industries today that we're talking about today. Next slide, please. Counseling or social services is part of rate group JA, along with alcohol or drug treatment. Counseling or social services represents the majority of this rate group at 89% of the rate group's payroll. Next slide, thank you. For counseling or social services, the cost rate and base rate were on an increasing trend, although in 2026, the base rate decreased slightly due to a reduction in the industry's deficit. The rates are projections, and they're based on historical data, and actual results can differ, resulting in a surplus or deficit. This slide details the cost components which make up the base rate for counseling or social services. The base rate for this industry is expected to decrease by 12 cents or 5% in 2026. This is due to slightly higher costs that were more than offset by a reduction in the industry's deficit adjustment. The left side of the slide are the components that make up the total cost rate for the rate group. This is the percentage of assessable payroll that WorkSafeBC must collect to cover the anticipated costs of new claims that are incurred by the rate group in a given rate year, and the future costs of administering those claims. That brings us to the right side, which starts with the total cost rate and then further adjusts for items that are specific to this CU, such as the amortization adjustment, which applies the surplus or deficit, and industry-funded initiatives, which is the HSA, it couldn't be the HSA levy, to come to the base rate. Next slide. Next, we have residential social services facility. It is its own rate group, and it is the only industry in rate group IH and represents 100% of the claimed costs and payroll. For residential social service facility, both the cost rate and the base rate have been on an increasing trend. The rates are projected based on historical data, and the actual results differ, resulting in a surplus or deficit. In 2025, the base rate rose above the cost rate to recover a deficit. Now let's look at the details, the cost component details for rate group IH and CU residential social service facility. The base rate for this industry is expected to increase by 57 cents or 10% in 2026. This is due to slightly higher costs and an increase in the industry's deficit adjustment. In previous years, rate increases and decreases were held to 20%. But in 2026, the capping is slightly different. Rate increases are limited to 10% for 2026, and the decreases were allowed to go up to 40%. So again, starting on the left side are the components that make up the total cost rate to collect and cover the amounts for claim costs and the amount to the cost to administer those claims. That brings us again to the right side, which starts with the total cost rate and then further adjusts for items specific to the CU. Although since this is its own independent rate group, both sides are applicable only to this group. And thank you. Now we're going to talk about life and job skills training. It's not large enough to be its own rate group, and it has been placed with other industries with similar claim costs in Rate Group 9. To review the membership of Rate Group 9, please visit Find Your Classification Unit, Industry, or Rate on WorkSafeBC.com. The life and job skills training industry was a high-cost outlier in 2022 and was subsequently moved to a higher rate group to match claim costs. Since then, the base rate rose slightly above the cost rate to recover a deficit. Then in 2025 and preliminary 2026, the base rates remained close to the cost rates, but in a slight surplus position. The rates are projections again, and they're based on historical data, and the results can differ, resulting in that surplus or deficit. So now to the details of the cost components for this CU. The base rate for this industry is expected to decrease by 4 cents or 2% in 2026. This is mainly due to an increase in the industry's surplus adjustment. On the left side are the components that make up the total cost rate to recover the claim costs and the cost to administer those claims, bringing us to the right side, which further adjusts to come to the base rate. Now I'd just like to touch on the COVID-19 claims. WorkSafeBC has received a number of inquiries on how COVID-19 claims are treated for rate setting. On July 26, 2024, Provincial Health Officer Dr. Bonnie Henry rescinded all provincial orders related to COVID-19. As a result, there is no longer a presumption that COVID-19 infections are work-related. In light of this, for the 2026 rates, the costs related to COVID-19 claims with an injury date on or after July 26, 2024, which were insignificant, have been included in the expected 2026 benefit cost rates. Similar to previous years, COVID-19 claims with an injury date prior to July 26, 2024 continue to be excluded from the cost rate calculations. Now let's talk about experience rating. An industry's base rate is just the starting point for the premium each company pays. WorkSafeBC's experience rating program examines the claims cost performance of each firm and awards as much as a 50% discount off the base rate or applies up to 100% surcharge over time. To calculate your experience rating, we look at claims costs for the past 3 years, the size of your firm in terms of payroll, and then we compare your claim costs per dollar of payroll to the average of your industry's rate group. Firms whose claim costs are the same as those other similar sized firms in their industry are considered average, and they pay the industry's base premium rate. If your firm has lower than average claim costs, you'll receive an experience rating discount. And if your firm has higher than average claim costs, you will receive an experience rating surcharge. Now let's have a look at an example. If your company has $1 million in payroll and your base rate is around the average base rate of residential social service facility of 6.27%, your premium would be $62,000 $700. But depending on your safety record, you could pay as little as $31,350 or as much as $125,400. That's a difference of over $90,000. Also, since all the COVID-19 public health orders have ended, COVID-19 claims with an injury date on or after July 26, 2024 will now also be included in experience rating. Previously, all COVID-19 claims were excluded. Now I'd like to hand it over to Corey to keep the presentation going. Thank you so much.
Thank you, Krista. I'd like to talk a little bit about time loss claims now. This graph shows time loss claim injury rates by the CU over the past 5 years from 2020 to 2024. The number of time loss claims per 100 people working all year, whether on a part-time or full-time basis. In the dashed black line, that represents all of BC. In 2020, it was at 2.13, and it's on a slightly downward trend, sitting at 2.03 in 2024. Starting off with the orange line, counseling or social services, that number was at 1.55 injury rate in 2020 and has moved up to 2.13 in 2024. The blue line, representing life and job skills training, started at 2.75 in 2020 and has trended slightly downwards to 2.71 in 2024. The green line represents residential social service facility, and this number was at 5.79 in 2020. And as you can see, it's sort of been up and down, and it resulted in 5.60 in 2024. And I'll talk to a little bit more about where this data is available. May I have the next slide, please? Claims costs paid by CU from 2020 to 2024. So again, starting off with counseling or social services, this is, this number has more than doubled from almost 7.62 million in 2020 to 15.9 million in 2024. So again, that would be the orange line represented on this slide. The blue line representing life and job skills training, it's difficult to see, but there is actually an increase in costs, but from roughly around 35%, from 1.69 million in 2020 to 2.28 million in 2024. Moving on to residential and social service facility, the time loss claim cost for this CU was 13.42 million in 2020, and in 2024, it was almost 24 million. Time loss claim costs in this CU have increased by 79%. Next slide, please. So let's take a little bit closer look at counseling or social services. These represent the top 5 accident types from 2020 to 2024. As you can see, the claim counts are on your left-hand side of the slide, and on your right-hand side are the claim costs paid. Violence-related claims represent 19% of counts, but 40% of costs. Exposure to toxic substances, which is represented in that sort of bright red color on your left-hand side of the pie chart. This does include COVID-19 claims. 85% of these claim counts are related to respiratory inflammation injuries from bronchitis to pneumonia, H1N1. It's a top 5 count at 7.6%, but it is not the top 5 costs. These claims only represented 1.7% of costs. Other accidents is not in the top 5 counts on your left-hand side, but it is in the top 5 costs at 18%. Many psychological injury claims are in this accident type. And on the left-hand side, MVI is not in the top 5 counts, but in the top 5 costs at 7.1%. Moving on to this next slide, occupations from 2020 to 2024 represent social and community service workers represent 57% of the time loss claims count, excuse me. And as you can see, the rest of the pie is distributed amongst a variety of occupations. And then there's a large portion under remainder. Remainder category includes everyone from program leaders and instructors in recreation, sports, and fitness, nurses, cooks, managers in social, community, and correctional services, as well as social workers. So it's a really diverse group of occupations that are in that remainder portion. Next slide, thank you. Life and job skills training. I'm going to go through a similar breakdown with this CU. So the time loss claim counts again on your left-hand side, and the claim costs paid on the right-hand side. So violence-related claims, again, represent 22% of counts, but 39% of costs. And these statistics are very similar to the 2019 to 2023 5-year span. Exposure to toxic substances, which included, again, COVID-19 claims, and a good portion of these are respiratory inflammation, similar to the previous CU, or counseling or social services. It's in the top 5 counts at 11% and represents about half, 5% of the claim costs. MVI is not in the top 5 counts again. So again, that's motor vehicle incidents. They're not in the top 5 counts, but they are in the top 5 costs. Administrative offices, interestingly enough, that occupation makes up 75.9% of the motor vehicle incident claim costs paid. So the only area where that occupation sort of overrepresents. Top 5 occupations for life and job skills training in terms of claim counts. Again, the majority of the frontline workers and social and community service workers. However, there is a small portion of other occupations represented again in the pie graph. And then the remainder, that 13%, again, is diverse occupations, but with very small portion of injury counts, less than 10. Next slide, thank you. Residential social service facility. The next slides I'll talk to similarly as I have to the previous classification units. So again, these are the top 5 accident types from 2020 to 24 in residential social service facility. As you can see, time loss claim counts on the left-hand side versus the claims costs paid. Violence-related claims, again, represent 30% of counts, but 44% of costs. Exposure to toxic substances, again, is included COVID-19 claims as well as respiratory inflammation. It is in the top 5 count at 12%, and these claims represent 5% of costs. Other accidents is 7% of the counts, represented in that green color on the pie graphs. Most, again, of these injuries claims are psychological injury claims at 85.4%. And moving on to occupations, again, as you can see, the bulk of the occupation with the majority of time loss claims is in social and community service workers. The remainder portion, again, represents cooks, nurses, light duty cleaners, licensed practical nurses. So again, diverse group. And as you can see, the other occupations are listed on the pie graph as well. Thank you. So the next 3 slides speak to psychological injury claims, which have seen an increase within social services industry over the last few years. Specifically, I'd like to just talk to sort of what is presented here. Every year, WorkSafeBC publishes an update to its media background on psychological injury claims. 5 years of data is provided, including breakdowns by industry and occupation. And there is a link at the bottom of the slide that would take you directly to that media backgrounder. Not all claims registered receive an allow or disallow decision. Some claims are suspended and do not proceed through the decision-making process. This happens after the claims are registered and is often a choice workers make not to proceed with the requirements of the claims inquiry process, including obtaining diagnosis from a psychologist or psychiatrist. Suspended claims may proceed at future point and receive an allow or disallow decision. So in June 2024, the mental disorder presumption was amended to include community integration specialists, coroners, harm reduction workers, parole officers, probation officers, respiratory therapists, shelter workers, social workers, transition house workers, victim service workers, and withdrawal management workers. I'm sure some of those titles very familiar within the social services sector. Psychological injury-only claims are adjudicated under Section 135 of the Act for workers in an eligible occupation with a mental disorder caused by a traumatic event. The claim is first considered under the presumptive clause in Section 135(2). So just hovering over this slide, hopefully you identified some of those areas of the healthcare and social services, residential social service facility, and counseling or social services, and pulled out those numbers that match some of the CUs that we're talking about today and represented today. Thank you. Next slide. Psychological injury only claims, again, from 2020 to 2024. Just to briefly point out here that social and community services workers are listed second for psychological injury only claims reported and allowed just after the nursing profession. So you can see large number reported as well as allowed. Next slide, please. This slide shows 2 out of the 3 Community Social Services Health and Safety Association funded classification units with more than 20 claims with both a psychological and physical injury. As you can see on the slide, residential social service facility claim counts have increased, and counseling and social service claim counts have doubled from 2020 to 2024. Thank you. Next slide. The following 4 slides speak to where you can access more information and resources to support preventing injuries to workers in your workplaces. First of all, I'd like to speak a little bit to the shared data. So a lot of the information that I shared with you on the previous slides from classification units as well as general information comes from this shared data resource. So it's a great interactive tool. The link is just available on the slide on the lower left-hand corner. And so much of this information is available at WorkSafeBC.com. There is data tool dedicated to acts of violence and force, filters for searching for specific data sets. So again, some of that information like claims by occupation, claims by source of injury, and claims by nature of injury, along with a tab to include all the definitions to explain those terms. Another available resource for organizations is something that we have access through your online account. And it's a great interactive tool that gives you an overview of your organization's health and safety performance. The Employer's Health and Safety Planning Toolkit. It gives you easy access to your organization's data to see the injuries and claims that drive your costs. It has various drill down features to enable you to take action. It shows how improving your health and safety performance will impact your assessment rates. So something that was talked about earlier with Krista. And you can see how you compare to your peers. So on the right-hand side, there is some information of how you compare to your peers in terms of experience rating, injury rate, and percentage of serious injury, and even duration of claims. There's some great video overviews of this powerful application available on WorkSafeBC.com. You can sign up to use it through your online account and get access to your data. Forecasting features are targeted to larger employers with 5 claims or more per calendar year. Next slide, thank you. So this is an excerpt, claim breakdown maps on the left-hand side, showing something that would be available through the Employer Health and Safety Planning Toolkit. The top graph shows number of claims, and the bottom graph shows the cost of claims. So again, this is information that you can pull, and you can filter it as well by accident type, source of injury, body part, and occupation. So you can look at trending within your own organization in terms of injuries. The right side of the slide shows that experience rating forecaster tool for those large organizations that have that 5 or more claims per year. And you can look at where your 3-year projected rating would be based upon the past 5 years. Next slide, thank you. Using online resources. So WorkSafe provides a lot of prevention and return to work resources, tools, and applications to support employers in preventing injuries and reducing claim costs in their workplaces. This includes videos, books, bulletins, and info sheets. These visuals are a collection of current resources available, and some of them that are specifically geared to social services. The Certificate of Recognition program is something that some of you may already be familiar with. It's often referred to as the Partners Program. For those of you that are not, the Certificate of Recognition program is a voluntary program that recognizes employers and that are proactive about improving workplace safety. While the program is optional, in some industry it has become a requirement of contract award. This is not a WorkSafeBC policy, but an industry practice. The program has two components. First, employers implement an occupational health and safety management system. The system is audited to WorkSafeBC standards, and if the employer meets these standards, they are awarded a certificate of recognition. Second, employers with a core or certificate of recognition are eligible to receive financial incentives. Employers that join the program will have the benefit of a safer and healthier workforce and work environment. It may also offer a competitive advantage, such as make it easier to attract and hire workers, as well as keep those workers and retain them. There are also a number of positive financial impacts, such as improvement in your company's experience rating from fewer worker injuries, as well as financial incentives for employers whose health and safety management systems have passed an audit and are in good standing with WorkSafeBC. Next slide, please. Of course, you can get help from your Health and Safety Association, Community Social Services Health and Safety Association of BC. One of the newer health and safety associations, but is making great strides within the sector and industry. They're funded from your premiums, and if you pay a levy, you are a member. And as you can see, there's a variety of associations that represent different sectors within BC. Preventing injuries from happening is the most effective way to keep your workforce safe, improve performance, and control costs. But if an injury does occur, another way to improve performance is through timely and suitable return to work. Next slide, please. Now that you've seen the numbers, let's talk about return to work. Counseling or social services had 36,187 days lost in 2024. Life and job skills training had 4,966 days lost. Residential social service facility had 28 days lost. The impact of time loss injuries is significant for both workers and employers. When you consider lost productivity and the cost of hiring and training new workers, the impact on employers can be several times greater than those direct claim costs. We know that time off work to recover is necessary in some cases. We also know that prolonged time away from work can hinder workers' recovery. So this is why return to work planning is so important in an injured worker's recovery, and why early intervention and maintaining a connection to the workplace is critical to improving recovery and return to work outcomes. This visual is a great way of looking at return to work planning. It starts in the middle with a worker and employer, usually the supervisor or return to work coordinator at the center. The process starts with a clear procedure for reporting of the injury and discussing next steps with the injured worker. Second, make a specific offer of suitable work. When appropriate, have the discussion with the injured worker before they leave the workplace and put the offer in writing so they can review it, and if needed, discuss it with their healthcare provider. Third, work together to build a return to work plan that reflects the worker's current abilities, and where appropriate, incorporate input from the healthcare provider. Continue to monitor and troubleshoot, recognizing that even the most carefully considered plans may still need adjusting. Communicate and adjust the plan as the worker's function improves. Finally, follow up with the worker once they've returned to the pre-injury duties to ensure full recovery and no re-injury. Next slide, please. You can also find additional tools and resources for both physical and psychological injuries on our Return to Work Information Hub at WorkSafeBC.com. Here you can also find WorkSafeBC's new Return to Work planning tool that is set to launch soon. In addition to the return to work planning tool, we have a new employer guide called the Managing a Safe Return to Work. That includes tips and templates to help you develop a seamless process for managing workplace injuries and helping your employees or workers get back to work safely. Another new tool for employers who have a designated return to work coordinator, established procedures for injury management, and an inventory of suitable work they can offer. We have the Early Access to Physiotherapy Program, or EAPP. For those that qualify, you can partner with physiotherapy clinic in your area. The clinic will provide an assessment of the injured worker within 72 hours of the injury, complete a functional abilities form within 24 hours of the initial assessment, and if the claim is allowed, can provide on-site coaching at the employer's job site to return to work planning and support. Check back on the hub regularly as resources are continually updated and revised. If you have any questions or like additional training and education on return to work planning, identify options for suitable work, or understanding your return to work requirements, our consultation and education team is here to help. And that information is listed on the slide. Thank you so much for all the information that you've been given and throughout this presentation, and we have some time now for your questions.
Thanks, Corey and Krista. Does anybody have any questions for Corey and Krista while they're here? And if anything comes up over the next week, please feel free to reach out to us as well, and we can relay those information. Yeah, if there's no questions, I just want to invite everyone for our next webinar, which will be about working alone and in isolation in social services. Corey will be presenting there as well. She's going to go over the legislation piece of working alone, and this will be in collaboration with a member organization who will be presenting their best practice in terms of a working alone program. As well as our OHS advisor, Savannah, will be going through over resources that we've developed for the working alone and in isolation and any check-in procedures app. So that's where you can go for those information. Any question? There's no questions. Please fill out the survey after this webinar. And because the working alone was actually guided from last year's survey results. So if you have any recommendations for webinar topics, please feel free to put that on the survey after this. And if there are no other questions, I'd let everybody go so that they can, you can go back to what you're doing. Again, any questions, please feel free to reach out to us. Thanks, everyone. Thanks, Krista. Thanks for attending.
Thank you, everyone. Have a great